Hi, I'm Dr. Kari Northheim from the College of Public Health at the University of North Texas Health Science Center. Today, we are addressing a critical but often overlooked issue, rural health and resilience. It's important to remember that 1 in 5 people in the U.S. live in rural communities. These areas face unique challenges shaped by geographical narcissism, which is the tendency to overlook rural areas in policy and resource allocation, and by the social vulnerabilities that act as effect modifiers. These vulnerabilities, such as low income, education gaps, and a higher proportion of older residents, exacerbate the impacts of chronic rural health issues. In addition to these challenges, rural communities are hit by the double burden of malnutrition and obesity, creating a complex food security health landscape. These social and economic disparities are compounded by limited access to healthcare, with rural areas having only 5.1 primary care physicians compared to 8 per 10,000 in urban regions. The result is higher rates of chronic conditions like diabetes, heart disease, and shorter life expectancies. Climate change further complicates these challenges. A powerful visual representation in the temperature change by season across the contiguous 48 states from 1896 to 2023 is shown on the visual. You can see specifically in the northern US, the winter season is much warmer. Rising temperatures and extreme weather events disproportionately impact rural areas where communities rely heavily on outdoor labor and agriculture. Heat-related illness occur at higher rates in rural areas compared to urban areas, with fewer social and economic resources available to manage the impacts. Changing weather patterns, including more intense storms and unpredictable conditions, further complicate safety and working schedule for outdoor workers. Climate change, particularly rising temperatures, has expanded the geographical range of vectors like mosquitoes and ticks. Warmer climates allow these species to survive and breed in regions previously too cold for them. As a result, diseases transmitted by these vectors, such as malaria, dengue, and Lyme disease, are spreading to new areas, increasing public health risks. To build resilience, we must follow a framework of awareness, assessment, planning, implementation, and monitoring. This is highlighted in the climate adaptation model, which offers a strategic plan to reducing rural vulnerabilities. Awareness starts by recognizing the challenges rural communities face. We then assess needs, plan, and implement tailored interventions, and continuously monitor outcomes to ensure long-term success. From a rural policy implication, policymakers must consider regenerative agricultural practices, improvements to rural utility services, and comprehensive food policy reforms as a central strategy. Regenerative agriculture not only increases productivity, but also captures carbon, which mitigates climate effects, and expanding rural utility services, such as modernizing aging water systems, can shield communities from climate-induced deterioration. Education and training programs can also empower rural residents to identify safer, lower-risk areas for development. And finally, protecting and restoring forests and ecosystems not only enhance climate resilience, but also safeguard the livelihoods of those who depend on these natural resources. Indigenous knowledge is central to this conversation, and rural communities can benefit from integrating these traditional environmental practices in these modern policy frameworks. And in conclusion, rural health and resilience demand our attention as the impacts from climate change are unrelenting. The future narrative needs to be about rural communities not only surviving, but thriving in the face of climate adversity.
Thank you, everyone, for joining us today. My name is Mona Aurora, and I am an assistant professor at the University of Arizona College of Public Health. I'll be talking about the impact of climate change on health and well-being in rural communities and highlighting some of our efforts to address health inequities that are at the root cause of climate and disaster vulnerability. As you can see on the slide here, 1 in 5 people in the U.S. live in rural areas where the median household income in 2021 was less than $59,000, compared to a little over $70,000 nationally. According to the CDC, the leading causes of death among those living in rural communities include preventable diseases such as heart disease and stroke. Health outcomes such as these are driven further by factors such as the distance and transportation to healthcare services and healthcare workforce shortages. All three factors shared on this slide also increase risk and vulnerability of climate-driven disasters in rural communities. Climate change is a global phenomenon with local impacts. As climate change alters ecosystems, no aspect of society is untouched. Milder winters and extremely hot summers create the perfect conditions for insects like mosquitoes and ticks to reproduce. Extreme heat can increase airborne allergens and pollutants, elevating the risk and severity of respiratory diseases like asthma and cardiovascular diseases. In this map here, we look at community resilience estimates for heat. Here we see counties across the US, but particularly places that are traditionally less hot, like Maine, North Dakota, and Alaska. These are among the nation's most socially vulnerable to extreme heat exposure. Why? Because partly they're far less accustomed to extreme heat and as a result, less prepared. To illustrate this connection further, let's take a look at housing as a driver of health. Pulling from the fifth edition of the Housing Assistance Council's Taking Stock report, 13% of rural homes are manufactured or mobile homes, which is nearly twice the national rate. Homes in rural communities are also older than those in suburban areas, with approximately 53% of rural homes being built prior to 1980. In the context of extreme heat, we know that older homes are generally less energy efficient and require more energy resources to heat, cool, and maintain. Research has also shown that during heat season, mobile homes with their poor insulation increase heat risk among residents due to poor ventilation. In this way, we see how the social determinants of health impact both an individual and a community's vulnerability. While factors associated with employment and housing impact access to air conditioning and energy affordability, age and overall health can impact our body's ability to cope with extreme heat. Building resilience against climate change requires innovative approaches that are place-based. In the context of extreme heat, it is unreasonable for us to expect urban-centric strategies like cooling centers to be effective. However, we know that community spaces such as libraries are lifelines for rural communities as resources. I'd like to close with this slide here that highlights the work we're doing in partnership with small and rural libraries to address health inequities through health literacy programming, including healthy cooking classes, yoga workshops, and telemedicine hubs. I look forward to sharing more about these programs and learning about other efforts that you're engaging in to build rural resilience. Thank you so much.
Hi, my name's Russell Hopkins. I'm one of the co-founders for Partners for Rural Resilience. We're going to talk today about planning for recovery from disasters. On April 29th, 2017, 7 tornadoes ripped through Van Zandt County in Northeast Texas. Over $9 million worth of damage, killed 4 people. Those tornadoes were EF3 and EF4. And during that time, my partner, Melissa Oden, was involved in a project called Planners for Health, a partnership between American Planning Association, Texas Public Health Association, and then was funded by the CDC. The Planners for Health team came in when asked to help prepare a recovery plan and did an evaluation of disaster plans, and at that point designed a preparedness and recovery toolkit with a focus on rural areas. At the end of the project, they then conducted roundtables to disseminate the project. And additionally, the team used a social determinants of health lens to focus on recovery and rebuilding a stronger and healthier community. One of the most important facts that was gleaned from conducting the roundtable event was the importance of creating and maintaining a long-term recovery group to assist communities in galvanizing and beginning the recovery process. When the Planners for Health grant was completed, a new project was created called Rural Community Recovery Awareness and Training Project, or as we called it, RCRAT. The newly created team was tasked with visiting other rural communities in Texas to help them develop their own long-term recovery groups. The criteria for identifying those communities was to have had a natural disaster within the last 5 years And we traveled to 4 counties over the course of 6 months, working with each community to help them launch their own long-term recovery group.
Hi, I'm Dr. Melissa Oden, co-founder of Partners for Rural Resilience. The end of the RICRAP project gave way to the birth of a nonprofit whose mission is to continue the work of the previous projects. The vision of Partners for Rural Resilience is to increase resilience in rural communities through improvements to the social determinants of health. Our mission is to assist rural communities in creating a preparedness culture to address the disaster recovery domains of economic, physical environment, healthcare, food security, education, and the social and community context. The end result of our work is to create resilience in each of the rural communities we work with so that in the event of a natural disaster, they are ready to face the challenges of recovery more quickly and effectively. Or, as we like to say, these communities are rural and ready. The second most important thing we learned from working in these communities is the importance of what our team identified as community touchstones. Touchstones are the characteristics that make a community unique. These are things like the fire in the barbecue pits in Lockhart that have never gone out since they were lit over 100 years ago, and that the community would do anything it took to make sure they do not go out. We contend that it is crucial that we work with communities to identify those touchstones and help communities preserve them within their disaster planning. Through the model that Partners has developed over the last 7 years, it is our position that special attention needs to be paid to rural communities to create pre-disaster resilience. This includes gathering crucial data in the form of assessment, intervention via in-person workshops, and continuing technical assistance throughout the planning cycle. Ultimately, we want to facilitate sunny day conversations with each community to empower them to respond to community disasters swiftly and effectively.
Hi, good afternoon. My name is Hal Zawacki. I am the Assistant Regional Director for SAMHSA Region 9, here to talk about climate change and behavioral health. In 2021, the World Health Organization described climate change as the most pressing public health challenge facing humanity. The following year, SAMHSA published a request for information seeking input on the topic mental health and substance use well-being in the context of climate change and health equity. We received over 100 replies from stakeholder organizations and individuals with insights and recommendations. Some key ideas throughout the responses were climate change is a social determinant of mental health, and behavioral health systems must become climate informed. Recommendations included supporting a climate and behavioral health approach and promoting prevention and resilience. In addition, responses emphasized a focus on populations most vulnerable, including children and youth, people with behavioral health conditions, low-income or disadvantaged populations, indigenous communities, people with outdoor professions, and people who work the land. Behavioral health responses to climate change need to include acute, subacute, and chronic conditions. For example, acute would be the emergency response to things like storms or wildfires. Subacute would be stabilizing the individual or community in the short term, and chronic would involve the long-term PTSD and anxiety that can result. SAMHSA's Disaster Technical Assistance Center has a long history of responding to the post-disaster psychological needs of a community. And DTAC is adapting its portfolio to deal with a wider variety of climate-related disasters. SAMHSA also provides emergency response grants to deal with immediate post-disaster behavioral health issues and grants that can support a community for a year or more dealing with anxiety and other subacute conditions. SAMHSA funds psychological first aid programs to allow individuals to deliver basic behavioral health response skills following disasters or critical incidents. And SAMHSA works with FEMA to provide crisis counseling assistance and training to disaster response workers. SAMHSA supports mental health first aid trainings across the country to enable lay people to have basic knowledge of mental health so they can assist their neighbors or friends in crisis. Over the last few years, the impacts of climate change on our physical world have become obvious. What is more hidden is the psychological impact of climate change. It is not only the experience of a drought or wildfire that creates the psychological stress, but also the looming concerns about climate change effects to come. For example, a study in The Lancet found that more than half of young people report feeling humanity is doomed as a result of climate change. About 1 in 10 Americans reported experiencing symptoms of anxiety and depression related to climate change. Behavioral health language is adapting to these concerns. Some new terms include climate distress, climate resilience, ecological anxiety, solastalgia, and normalizing, which refers to the post-disaster response that tries to get people back to normal, but doesn't address underlying trauma or anxiety issues. Community resilience is the ability of communities to withstand and recover and learn from past disasters. It can involve putting in place the infrastructure to allow a community to function in the face of adversity, to survive or even thrive. Resilience hubs can be a way to build resilience in your community. There is no one size fits all. Most include the ability to address climate change threats that may occur. Most include mental health care as a key component. Developing a resilience hub can be challenging in rural and disadvantaged areas due to higher rates of poverty and limited infrastructure. In Nevada, there is a resilience rural community that is braiding together USDA and other funding to develop a mental health center that includes a food bank for seniors and a safe space during extreme heat events. Finally, a resilience hub can be a great way to reimagine your community. After the Maui wildfires, the state received emergency response grant funding from SAMHSA and plans to develop a resilience hub that will address not only the behavioral health needs of the community, but also its social and cultural cohesion. Thanks for the opportunity to discuss climate change and behavioral health. I look forward to the UnConference in October.